Okay, today I'm going to be giving a hepatitis B shot to Jonathan Jaden. He's a newborn, month old. I'm going to be giving 0.5 milliliters intramuscularly in the vastus lateralis, and it is 9 a.m. Okay, so I'm going to open up unlock my med drawer and open it up and take out my medication. I'm going to see I have hepatitis B, 0.5 milliliters. I'm going to look for the expiration date, 2/20/20, perfect. I'm going to look and see, this is a multi-use vial, and it should have a date when it was opened, so that's good. And I'm going to check the lot number, fine. And I'm just going to, this is my first check, and I'm going to make sure I'm giving Jonathan Jaden his birth date, make sure he has no allergies to hepatitis or anything that's in here. He's getting 0.5 milliliters, and this is a multi-use vial, so I am good with that. Okay, so I'm going to take my alcohol. Well, I'm going to wash my hands before I start. Wash my hands. I'm going to take my multi-use vial, clean that really well. I'm going to open up my syringe, and I'm going to use a 1 milliliter syringe with either 5/8 or 1 inch needle for the baby's size, and I'm going to give it to him in the vastus lateralis because it's a big muscle. There. To give 0.5 milliliters of air. I'm going to put it in there. Okay, and I'm going to draw up 0.5 milliliters. Alright. Making sure I get rid of all my air bubbles. Okay. Perfect. Okay. Alright, and I'm just going to put that back on my sterile dish. There we go. Get rid of all my extras. And I'm going to take my I'm going to do my second check before I put my medication away. I'm going to make sure that I'm giving it to Jonathan Jaden. I'm giving heparin, 0.5 milliliters, 0.5 milliliters. I'm giving this IM. I'm checking the expiration date and the lot number, and I would write down the lot number before I leave, since this is a multi-use vial. Then I would put this back in my drawer, lock my drawer, and then gather my supplies into my room. Knock, knock, knock. Good morning. Hi, my name is Kathy Sarno. I'm a student nurse with HCC, and I'm going to be giving Jonathan his hepatitis shot today. We're going to vaccinate him against any hepatitis that he might come in contact with. And this is his first hepatitis, so you know that like in a month he needs the second one, and 6 months later he needs his third one. So the nurse will schedule you for that when we get out there. Okay, and so to start, I'm going to come over, wash my hands, and I'm going to check the baby's sight to make sure everything looks okay. Hello, little guy. Oh, looks good. Okay, there's nothing on his leg, so I can go ahead and give it to him there. On his right vastus lateralis. Can we table this a little closer here? So I'm going to put my gloves on first. Get my landmarks. I'm going to put my my palm on his knee, and I'm going to wrap my fingers around underneath his little leg to make it stable, and I'm going to push down, and right in between the V is where I'm going to clean his little leg area. in a circular motion, in to out. That's what I'm going to be doing on here, in to out. And then I'm going to put my swab in my hand. I'm going to take my needles. I'm going to come over and I'm going to hold firm, spread the muscle out and hold down, just pinch a little bit, and then bevel up on 90 degrees. Again. Okay, so I'm going to do that here. I'm going to spread, pinch a little bit, pulling the muscle up, and go straight in, bevel up, aspirate, put my medication in. Slowly, wait a few seconds, and hold. I'm going to recap my needle, and I'm going to check the site, make sure that it's okay. I'm going to tell the parents about Jaden's, if there's any redness, swelling, if he gets a fever, temperature, that they should contact their care provider, and to let somebody know. And I'm going to be back in 15 to 30 minutes to check the site and reassess. And so I'm going to gather my supplies, and they are, and go back out to my cart. And out here, I'm going to dispose of my needle. Then I'm going to take my gloves off, wash my hands, and document. And I'm going to document that I gave him his shot in his right vastus lateralis at 9:15 a.m. I'm going to put my initials. I'm going to make sure that I have the right dose, the right route, the right time, the right medication, and the right reason for my patient. And I already wrote the lot number down because it is a multi-use vial. And the other thing that I didn't do was I didn't do my 2 checks on the patient to check for his wristband, his check with the mom, check with the lot, with the medical record number, and I didn't close the curtain for privacy. So, and I think that is it.